Warm greetings to one and all. Let's wait for a couple of minutes while we admit the rest of them. Hope you all can hear my voice clearly. So once again, this is Dr. Anita Sarjan, your MC for the session. If you wish to claim your certificates for the same, kindly visit our website, which is www.onlinedentistry.in/9 p.m. and register for the same. Online dentistry has been the pioneers in providing dental education via both online and offline platforms. The motto we preach is to redefine dental education. It has been over 14 years that online dentistry have been conducting sessions for clinical practitioners across the globe. Established in the year 2008, so far we have covered over 203 offline courses and have conducted 1,022 online courses with an enormous amount of more than 30,000 followers on our platform. Let me proudly introduce the CEO of online dentistry, Dr. Binuti Abraham, who is one of the finest practitioners in town, an orthodontist by profession, a passionate photographer, and he owns his private practice at Kerala Dental Clinic, Aluva. Currently, he's interested in educating thousands of clinical practitioners through both online and offline sessions. Moving on to the academic head of online dentistry, Professor Dr. Joby Peter. He's currently the HOD of Department of Pediatric Dentistry at Anu Dental College, who preaches the philosophy to catch them young and watch them grow. Over the years, we have grown dynamically, launching 10 centers in different parts of India. The latest addition to our courses, the one-year comprehensive and advanced master training program on interceptive and myofunctional orthodontics, have been successfully initiated with 2 batches. So this is a multidisciplinary approach with intense training and hands-on sessions as well. Our program is now a fellowship program on interceptive and myofunctional orthodontics, which is accredited by the Manipal University College, Malaysia, which is indeed a sister concern of Mahi University. Herein, 2 of the modules will be happening in Malaysia, along with the graduation ceremony and a certificate distribution as well. We are open for registrations for the next batch, which commences on September 22nd, 23rd, and 24th via our website. Another feather to our cap, the program is about to commence on 28th, 29th, and 30th of April at Cochin, which will be an amazing workshop on interceptive and myofunctional orthodontics. We are thanking you all for your overwhelming responses. We are happy to announce that we are a batch full and open for registrations for the next batch. On popular request, we are coming up with yet another interesting workshop on interceptive and myofunctional orthodontics on the 23rd, 24th, and 25th at Cochin. You can always feel free to reach to us on our WhatsApp numbers or visit our website, which is www.onlinedentistry.in, or else you can mail us on onlinedentistry.in@gmail.com. Online dentistry have been conducting sessions all over India for the past 14 years. During the lockdown, we have started conducting online sessions to benefit the practitioners, which have been received with great appreciation from the dental fraternity. In the year 2023, we are relaunching the same by providing free advanced learning series under the title Online Dentistry at 9 p.m. Without further ado, let me move on to introducing the speaker for the day, Dr. Krishna Kumar R. He completed his BDS from Rajiv Gandhi University of Health Science, Bangalore. He secured his MDS from Oxford Dental College and Hospital and Research Center, Bangalore. Currently, he is undergoing his postdoctoral qualifications. He have attended numerous national and international conferences. He has also done poster presentation on the 32nd ISPPD conference and IEPD National Regional Meet at Amritsar. To his credit goes international presentations on the 24th, 25th, and the 28th IEPD conference. He is also credited with numerous national and international publications. So, we proudly welcome you to Online Dentistry, sir, and the session is all yours. Welcome. sir.
Thank you. Thank you, Dr. Anita, for the kind words. Yeah, firstly, let me thank the team Online Dentistry for the great initiative for the field of dentistry. Today, my topic is on painless and dental anesthesia. So just imagine tomorrow morning you need to reach a destination. You don't have a choice. You have to reach a destination, and you know that the journey to that place, you have to cross a jungle and reach the destination. And you have heard a lot of things about the jungle. That there are a lot of animal attacks that happens. There are a lot of people who have got hurt because of the animal attacks. But currently, you don't have a choice. You have to live. So, what will be the status of your mind? You will be scared, right? You will be scared, or you will be having that fear to go. So that fear will be there, but somehow you have overcome your fear, and then you started your journey. So you started your journey. So initially it was okay, but when it goes little more deeper, the roads are becoming narrower. The forest is becoming dense, and you don't know what is going to happen next. Moreover, there is no connectivity. You can't connect to the outside world at all because there is no cell connectivity at all. And when you take a hairpin bend, you're just seeing this guy in front of you. You are just seeing this guy in front of you. So, what will be your current mind status? What has happened is you have fear. That fear has converted to a phobia. Okay, so that fear is converted because what you thought or what you were expecting, that has happened. Reality has happened in front of you. So your current mind status will be somehow you have to just get up and run because the elephant is charged and is ready to attack at you. So you want to just run and get out of the place. Similarly, in dentistry, what happens is in dentistry, all will have some or the other myth about dentistry. They will tell a lot of things about dentists. Even if you Google online, you can see a dentist with an injection or a dentist with a tooth who is going to extract a tooth. All those things you will see. So already there is a myth or there is a scary factor is there. And imagine if you come across with the same scary factor. If you come across with the same scary factor, it will lead to dentophobia. You get phobic or your fear will get intensified. So we all know that there are different methods of management of fear, or there's different methods of behavior management techniques, right from the non-pharmacological way to the pharmacological way. There's a huge spectrum where it starts with the communicative and behavior guidance. You nicely talk to the child and relieve the fear, audio visual distractions. Then if you see that spectrum is getting narrowed and narrowed, and at one point you don't have a choice. You have to go for the pharmacological means of behavior management. So this is a spectrum of management of anxiety and fear and pain. So just have a look at the video. Just have a look at the video. So what's happening here? Here, there is changing trends in different generations of children. Okay, the parenting has changed. The way the child thinks has changed. The way the child behaves has changed. Everything has changed. So when it comes to dentistry as well, okay, there's a changing trends in dentistry from the good old clinical setup. We have reached to a place where more aesthetic, more multi-specialty center where you just name it, that particular procedure is available over there. And there is an addition of nitrous oxide where you can it's like a little more addition to your setup. And recently what has happened is we are all into the digitalization or revolution in digitalization. Same thing that is happening in dentistry, that is digital dentistry or digitalization dentistry. Or so a lot of clinics have now come up with impressionless clinics. All those things have come. So why, my question arises is why there is phobia again? Why the people are phobic towards dentistry? Why when they say you need to go to dentist, they are very scared. So there was an interesting survey that has happened. That was done in adult. That's what I want to try. I want to tell you that an adult dental survey was conducted, and there were 10,000, close to 11,000 people were part of the survey. And they found out that 50% of the people are phobic. Some or the other phobia they are having. And out of 11,000 participants, 1,400 participants are having dental phobia. They are literally scared of dentist or dental procedures or any of the equipments they are scared of. So there is a much more realistic or much more funny article what I found out is why people are afraid of dentists. Because a lot of things have come, right? There is digitalization has come, nitrous oxide sedation has come, more aesthetic dental clinic has come. But then still why people are scared of dentists? So when you see this particular article, they have quoted nearly 50 things that is fear causing to the patients. There are 50 things, right from the looks of the dentist to the looks of the clinics. Everything is there. Everything is there. So little more towards the pediatric dentistry side, there was a article which was published, and in that they listed out 15 things which is fear causing to the children, and out of which the one which is there in the third rank, the one which is there in the third rank is injections. So why I took this as my today's topic is because for any procedure, say for root canal you want to do, you need to give an LA. But which is, you should know that thing is ranked 3 for fear causing or phobic causing. If you want to do a vital tooth cutting, you require a local anesthesia. You want to do a flap surgery, so for anything, any little bit of invasive thing, you require local anesthesia. You require to give an injection. So imagine the child is coming to a clinic. Child is very calm. He has entered the clinic. You made the child sit. You spoke to the child. All those communications, everything has happened. And imagine you are ready to now do the treatment. Imagine the assistant is getting a tray and he's looking, or he saw this. He saw this there. So the same good old story of elephant, same thing. What he is expecting that has happened in reality. So what will be his mind status? Same way, right? Oh my God, am I in a wrong place? I want to just escape from this place. So my particular topic of today is leave the pain and enjoy the journey. I'll be talking about the newer techniques of local anesthesia where you can practice, you can make your practice unique when you implement in your practice. So a little bit of historical background. The cocaine was the first local anesthetic agent which was isolated by Neyman in 1860. That was the first local anesthetic agent which was isolated. And after that, because at that time they didn't know that there is something called as anesthetic properties there. So the anesthetic property or anesthetic action of this cocaine was demonstrated by Karl Correll in 1884. And the first effective and widely used synthetic local anesthetic agent was procaine, which was produced in 1905 by Enhorn. So this is about the evolution of local anesthetic agents. So now recently, lot of newer things have come, but If you see the technology of the vehicle which is being carried, that is the injection, in 1853, the injection looks the same. In 1904, the size has changed from borosilicate glass to a stainless steel coating that has come. From there, another 150 years ahead, in 2010, it has come to a cartridge one with an auto aspiration. All those things have come, but no much change. It's all the same. It all looks the same. So in 2023, if you take, in most of the practice, we'll be either using this disposable syringes, or you'll be using a cartridge, what I've discussed before. So what has happened is researchers were so keen. They were saying that injections, of course, there is phobia is there, but how can we modify this? Anything can be done. Why people are so phobic about just seeing this needle? So a survey was done. A survey was done, and an interesting result has come. What patients are saying is the prick, when you prick the needle to the firm, resilient oral mucosa, just if you're pricking it, that pain is much less than the pain the patient experiences when you are injecting the LA into the mucosa. So that is the one. So the force at which you are injecting the LA into the mucosa, that hurts more than the prick. So what has happened? So it's all interlinked. So they are getting scared of injections. So what has happened is, in 1997, a newer innovation has come in the field of local anesthetic delivery system. There is a computer controlled local anesthesia delivery system where the entire unit controls the flow of LA, the pressure at which the LA has to come. Everything is sensorized. Everything is sensorized and everything is computer controlled one. So these are the different brands of or different varieties of computer controlled anesthesia which is available in the market. So the question arises there is, who all you can give CCLA, that is computer controlled local anesthesia or anesthesia technology. So I will put across in this way: whoever or whichever patient is an apt candidate for giving a local anesthesia using a syringe. Okay, using a syringe, you can give a local anesthesia. If there is no contraindication for giving a local anesthesia, those people are all the ideal candidates for giving a computer controlled local anesthetic delivery system. So from infants till old age, you can give this technique, or you can give this computer controlled anesthesia. There is no absolute contraindication at all. If at all any contraindication is there, if there is any contraindication pertaining to the LA, local anesthetic agent, then there is a contraindication. But as such, there is no contraindication at all. So this is the computer controlled local anesthesia delivery system, which is called as WANT. So this is the first generation WANT which has been come into the market, and this one is a second generation WANT that has come into the market. There are a lot of disadvantage the first system had, because there is no auto aspiration. That technology was not there at that time, and there was only single mode was there. There was no multiple mode. So those were the disadvantages that first generation had. And when it comes to the second generation, all the disadvantages what was there in the first generation was being rectified. And this came at around 2010. This came to the market in 2010. So how does it work? Or what is the working principle of this? So before only I've told you, it is not the prick of the injection that causes pain. It is the flow or the pressure at which the firm, resilient mucosa takes the LA from the syringe that hurts more than the prick. So this STA system, that is single tooth anesthesia system, what it does is the flow rate of the LA is controlled. you can control the flow of the LA, and flow of the LA is somewhere around 0.5 ml per minute. So just imagine 0.5 ml per minute. So it will take time. It will take time to give LA, but it is very comfortable for the patient because that much of force of local anesthesia is not coming and hitting the mucosa. When it forcefully comes and hits the mucosa, that hurts. But when it slowly, when you are giving, the pain will be much, there won't be pain at all. The patient won't feel any pain. Second thing is the pressure at which the LA that comes out of the needle, that is also sensorized. So the flow of the LA is sensorized, and the pressure at which the local anesthesia that comes out of the needle, that is also sensor monitored. So the pressure is also reduced. So it will be more comfortable for the patient to take the local anesthesia. Little bit about the armamentarium. Here, one interesting thing is the entire system is being controlled by food. Like we are so familiar with the food control when it comes to the micromotor or aerotor or scalers, all the things are being controlled by the food. So this particular mission is also a food control mission. So this is how you're supposed to, this is a small video where you can we show how to connect the food control. So it is there just below the, in front and below the mission. You need to just thread it in so that the food control is now ready. Next thing is the anesthetic cartridge. How you're supposed to place the anesthetic cartridge. We are all familiar with the anesthetic cartridge, right? So there is a, when it comes to wand, there is an anesthetic cartridge holder is available. There is a tubing where anesthetic cartridge holder is there, and onto the anesthetic cartridge holder, you need to place the anesthetic cartridge in, and there is a spike that is present in the anesthetic cartridge. You can see here, there's a spike that is present in the anesthetic cartridge, and you need to firmly press the cartridge inside so that it punctures and enters the anesthetic cartridge. So this is a video that shows how to place the anesthetic cartridge into the anesthetic holder, where I'm now placing the anesthetic cartridge into the holder, and you can see I'm just pressing it with little bit firm pressure. I'm pressing it so that it the spike will enter, punctures the diaphragm, and enters the anesthetic cartridge. So this is one end of the tubing. You can see a tube there. So this is the one end of the tubing. And next thing, what I like to say is as an handpiece. I don't like to say it as a needle. It looks like a handpiece. For me, it looks as an handpiece. And at the tip, it is the needle where the LA solution will be coming out. And this is the tubing what I was talking about. And coming to the sizes of the needle, from 24 gauge to 28 gauge needle sizes are available. So pertaining to your requirement, your particular procedure, you can select what kind of needle you require and you can inject. And same way, there is a needle holder where you can keep the injection in the injection holder, which is there in the machine, where you can see in this diagram. So next is the insertion of the cartridge to the cartridge holder. So there's a inner wing. You can see there's an inner wing over here. So into the inner wing, you're supposed to keep the anesthetic cartridge holder, and you need to just, that inner wing is there on the top of the machine. So what you need to do is you need to just place the anesthetic cartridge holder onto the inner wing and just turn counterclockwise. You can see that you have just turned counterclockwise. By then the machine, by then the anesthetic cartridge gets hold to the holder. So it will be more clear when you see the video. So I'm just keeping the cartridge holder into the machine. Now I have counterclockwise direction. I have turned, and now what you can see here is now the machine is ready. All the lights are on. So what I want to try to tell you is the moment the cartridge enters the cartridge socket, the machine senses. The next second, what happens is the machine senses, the calibration occurs, everything is set. Now, actually, this machine is now ready to give LA. You need to just set the location and just give the LA. That's it. So that self-calibration, everything happens, which is well computerized and well censored the moment you place the LA cartridge into the socket. So coming to the little bit of what are all the modes that is available. So here, this one that shows the how much of local anesthesia is there in the cartridge. It shows the volume of local anesthesia that is there in the cartridge. And the first button that shows the auto plunge or retract, which means imagine you need to give a local anesthesia where only one cartridge is, you are using only one cartridge to give local anesthesia. You can put it in that mode and work it. No issues, you can work, no problem. But imagine for some procedures, you might require one more cartridge. So you can't, it is difficult, right, to remove again. So what you can do is you can just shift it to the multi-cartridge mode. You can, only thing is your assistant should be trained for all this. So once you shift to the multi-cartridge mode, you just ask your assistant to just remove the cartridge holder and place another new cartridge and place it back. Rest all calibration does by itself. All the self-calibration does by itself. So it won't interrupt in giving LA. Nothing will be there. You can just continue giving the local anesthesia. And the one that shows down, this different color lights, that shows the pressure at which the LA comes out. Secondly, if there is any resistance when you inject, if you get any resistance, that will be noted. So that is the, so you will get a visualization also will be there. That light will be coming. Same way, you can get a beep sound also when your injection is not proper, or when your injection needle has not gone and hit the place properly. That is also been sensorized. And you are having, in this particular mission, you are having 3 modes. That is the STA mode, where you can give a single tooth anesthesia. Second is a normal mode, like how you normally inject. And third is a turbo mode. And there is an auto aspiration, and that I have already told you. It's auto aspiration is there. That is for no matter which is in whichever mode it is, auto aspiration is there. Once first you prick, and when you activate with the foot, first thing it does is it aspirates first. Then only it will start injecting. So a little bit about the different injection techniques, different injection modes, what I was trying to tell you. First is the STA mode. So if you just see the video over here, you can see when I am activating with the foot, the volume of the LA that comes out is very less, and the frequency at which it comes, it takes 1 drop, it will come, and it takes 4 or 5 seconds. Then another drop comes. Then again it takes 4 to 5 seconds. Then only the next drop comes. Then it takes a break. Then it comes. So what happens is the flow of LA is very minimal. The flow of LA is very, very minimal, so that it will be very comfortable for the tissues. When it comes and hits the tissues, that pressure is not there. The pressure at which the entire 1.5 ml comes and hits, that is not there. So it's very, very comfortable for the patients as well. So next mode is the normal mode. Normal mode is nothing but normally without much pressure, when you inject the piston, when you press the piston, how the LA comes out. So I have just activated it. You can see here. Now the frequency has become much, much faster. Much, much faster. The LA started coming out. So this, when it comes like this, it hurts. The pain will be there because it is coming. You are not giving time for the tissue to absorb. The next moment, the next drop is coming. So patient will feel pain. There will be higher chances of pain. So the third mode is a turbo mode. Turbo mode means you are just seeing the anatomical landmark, you are injecting and just pressing it. So this is how in turbo mode it comes. It just flow. It just flow out of the needle. It just flow out of the needle. So that fast if it comes, that again is hurting for the patient. So just imagine when you are giving in a normal and a turbo mode, which is like how normally we give LA with the normal syringe. So what happens here when you are giving an injection? When you are giving an injection to the patient, okay, you have no control over the pressure at which you are hitting onto the mucosa, or the pressure at which you are hitting the piston of the needle. You don't know. Secondly, you don't know at what flow rate the LA is going and hitting the firm resilient oral mucosa. You have no idea. Thirdly, what I want to tell you is the needle what you are using in the computer control anesthesia, the same needle only you are using in the normal injections. The hub is the same, your vent is the same, but you don't have any feedback. Only feedback what you get here, because only feedback what you get here, once you prick, if the patient says, then you know that there's pain. Other than that, you have no feedback at all. You don't know whether the flow rate of the local anesthesia through the injection is right. You don't know. At what pressure it is going out, you don't know. So there is no feedback when you are giving a local anesthesia in a conventional syringe method. Whereas when you are using a computer controlled one, you have a total feedback. You know at what speed the local anesthesia is coming out from the needle. You can see it in the machine. Second thing is, you know at what flow rate it is coming, whether it is coming in a slow volume or it's coming in a very fast rate, that is also monitored. Okay. The next interesting thing is, if your direction of the needle is little away from, or if there is any resistance you get, that also is monitored. That will give an alarm that your direction of the needle is not proper. So you get a total feedback in the system, right from the flow rate, flow of the LA, to the pressure at which it is being injected, to the direction of the needle, to the direction of the vent of the syringe. Everything has been monitored, or everything you have a feedback is there. Whether it will either if it is something goes wrong, alarm will come or a beep sound will come, so that you can rectify it and give the local anesthesia. So these things are happening. Because of the one technology what this particular machine has. That is nothing but dynamic pressure sensing technology. That is DPS, where it monitors the exit pressure. That's what I was trying to tell you. It monitors the exit pressure at which the local anesthesia is being transferred to the oral mucosa. And it is not only when you're just giving the injection for the first time, it is there. No, it is there once you start till you end. Once you start the procedure till you end the procedure, that is monitored. That is real-time monitoring is there. And you will get a continuous information. If your flow rate of the local anesthesia increases, that will be shown on the machine. If the flow rate decreases, that will be shown on the machine. Same way, it's not only visual, but also audible feedback is also there, which means that the sound also will come. One beep sound will come. When the flow rate of the LA increases, the beep sound frequency will be more. Okay, so you have both visual and audible feedback. So the system will control the exit pressure. If the mucosa is fine, then at this pressure, it has to come out. That system will control. So coming to some cases where I have done local anesthesia with a computer-controlled anesthetic system. Here, one thing about this child is she's 18 years of age. and she's very, very scared of injections. She's a bit scared of injections, and she had come to us. So she need to undergo an orthodontic treatment. So what we have done is we have first slowly rubbed the mucosa. The protocols for giving the local anesthesia, that surface anesthesia is the same. First, you need to nicely rub the mucosa, make it dry. Then I have applied the local anesthetic gel. Ideally, we give a procaine gel or a lignocaine gel. Anything is fine. Keep it for 1 to 2 minutes, or you can keep the cotton there so that the entire gel get absorbed by the mucosa. Then again wipe it nicely. Again wipe it nicely and check for the sloughing of the tissue, whether the tissue is sloughened, like how we check for the normal topical anesthetic gel or spray when you apply, how it is there, the same way. Check for the sloughing. So once there is sloughing, this is the behavior modification we do. We introduce the needle, not as a needle. We introduce like a wand. That is why that machine is also named as wand. Wand is nothing but the angel's wand, that one. So we introduce to her like this, like a wand. You can't see any needle over there. The needle is not visible at all. So we are introducing it like a wand, and you are holding the needle at the bottom, and you're introducing like a wand. And to gain little more confidence to the patient, okay, you gain little more confidence to the patient. Without removing the hub, slowly hit on the mucosa and ask the patient whether you have pain or not. Just ask the patient. So you are attaining the confidence. Once you attain the confidence, slowly ask your assistant to just remove the hub. Then I've slowly started injecting. Now slowly I've started injecting. Now that you can see the needle is now started penetrating in. So of course, you guys will be having a doubt. I am just showing the pictures, right? There is no video at all. So this is a video where I've started giving the local anesthesia. Now to the buccal mucosa, I've started giving. So what you can see here is, if you look at the eyes of the patient, there is no response at all. If no signs of pain, nothing. If there is signs of pain, the child will start blinking the eyes, or some signs you will see on the face. Nothing is there. So patient is very comfortable taking the local anesthesia. So when it comes to wand, okay, it has been marketed now as STA, that is single tooth anesthesia system, where you can give single tooth anesthesia by just modifying the or just giving a bend to the needle. So just give a small bend to the needle so that the needle nicely penetrates into the periodontal ligament space. So here there is one more clinical scenario where I'm placing the needle slowly into the sulcus. So what I do is I give first the periodontal ligament injection on the buccal sulcus. Buccal free sulcus I'll be injecting, and same way the mesial and distal sulcus, then to the palatal mesial and distal sulcus, then to the palatal sulcus. So here, when you give a periodontal ligament injection there, you can actually extract the tooth without giving an infiltration. The tooth will get anesthetized, or you can do an access opening without giving an infiltration, because the LA is deposited in a very slow fashion and it takes time. The giving LA, it takes time. That is a major disadvantage of this machine. But the efficacy and efficiency of LA will be too good. So, and comfort, that is the main thing. When it comes to the comfort to the patient will be comfortable. He won't feel that you are pricking with the needle. So see one more case scenario where the child requires a pulpectomy with respect to 7.5. That particular teeth, she requires pulpectomy, and she's scared about injections. The moment she entered the clinic, the first thing she asked is, doctor, I'm very scared of injections. I don't want, because she had a bad experience. she had a bad experience. So we gave a periodontal ligament injection. We gave a proper periodontal ligament injections. And you believe it or not, we have done pulpectomy without infiltration, without block, nothing, just doing a single tooth anesthesia. So that is a major advantage of this particular machine. So coming to the scope of computer control local anesthesia delivery system, there is a demand, because once a new thing has been introduced to the practice, there will be demand, because you are giving an injection to a patient without pain, without discomfort, and without, the patient won't feel that you're injecting. Patient won't feel that you're injecting. So that comfort is there. So of course you will have demand. And secondly, this particular patient who had taken treatment with you, that patient will go and tell 100 others that if I went to this doctor and the doctor injected me, but I didn't even know that he was injecting me. No injection was there. No pain when I'm getting injected, nothing. So when he publicizes like that, there will be referrals. People will refer you. People will come to you. And of course, since you're giving something unique to others, it is an additional income. You can always charge, because this is not going to hurt the patient if at all you follow the proper protocols. So coming to the summary of computer control local anesthetic delivery system, first and foremost is it maintains the speed and pressure, with the speed of the local anesthesia and the pressure at which the local anesthesia that comes out of the needle is being maintained. Then it maintains the anesthetic pathway, because when you are giving a local anesthesia with a normal syringe, the anesthetic pathway you can't create, or you can't maintain an anesthetic pathway, because you are just injecting, and with the pressure you are injecting the needle into the mucosa, mucosa just swells up. But here the swelling of the mucosa won't be there. Slowly, when one drop will come, that will be absorbed by the mucosa. Then again another drop. So if you want to go a little more deeper, you want to penetrate it a little more deeper, that is also possible. And the third one is it has a fingertip precision, or a pen-like grasp, like how you hold a pen. That is how you are holding the handpiece of this machine, or handpiece of the needle. And it's designed to improve the ergonomics and precision of the injection technique. As I mentioned, because of this DPS technology, that is dynamic pressure sensoring, monitoring sensoring is there. So with that, the precision of the injection will be very much precise, and it has been foot activated delivery of the solution, because as I mentioned earlier, once you press the foot controller, automatically the LA starts getting delivered. Then increased tactile sensation and anatomical characteristics of the tissue is being maintained. So before I conclude my presentation, let me tell one interesting story. It happened in UK. A child of around 6-7 years, he wants to remove his tooth. He wants to remove his milk tooth. So what has happened is he started searching for dentist. He started roaming with his parents. So many streets he started roaming, and he's seeing only boards written as dentist, dental clinic. But when he reached one street, he saw another interesting board there, where he has written painless dentist. So what he thought was, okay, fine, let me go in and let me remove my tooth in a very painless way, because he has written there is painless dentist. So the moment he went inside, the doctor took his tooth, but unfortunately that was very painful to the child, because there was no modern technology or no new technology what he saw, because it was the same when he went to the normal dental clinic. But only thing is that board is written as painless dentist. So what he did was, the moment he came out, he just wrote as liar. He told, this dentist is a liar, don't go. But now things have changed. The changing trends have come. You can really practice painless dentistry by implementing small equipments in your dental practice. So to conclude, I'll put it like this. Bye-bye to tears and screams. Let's begin an empathetic approach and instills a positive attitude towards dentistry. Thank you.
Thank you, sir. It was indeed a wonderful session. Now you guys can post your queries in the chat box. So let me check the chat box. We have a thank you message from Dr. Nasim. Thank you for the beautiful presentation. We are waiting for your queries. Yeah, we have a question, sir, from Dr. Charan Teja. What is the cost of the unit, sir?
Yeah, if you're going for wand, it will be costing somewhere around 3 lakhs, 3 to 4 lakhs. But newer machines have come, like Woodpecker has come up with a computer controlled one. But one disadvantage of that particular machine is you can't hide the needle. Hiding the needle is little difficult, but otherwise, rest all the things are there, and it is handheld machine. It's not a foot held machine. So little bit difficulty is there, and that will be costing somewhere around 60,000.
Oh. Okay. Thank
but
you,
the
sir.
principles are all the same.
Okay, so the next question is from Dr. Reena. So which brand is good?
Which brand? I think here for computer controlled anesthesia, the best one is Wand. And another one which is a Korean made, that is its name is No Pain. There's one brand called as No Pain. And now, as I said, there are a lot of other brands that is coming up, but the only problem is they are all foot held. That is all controlled with the hand. So it is all handheld, and the controls are all in the hand. So that little bit difficulty will be there. And secondly, you can't hide the needle. Hiding the needle is little cumbersome in that.
Yes, sir. And also, where do we get the apparatus and the cost of the apparatus? Maybe from Dr. Lavanya.
Cost of apparatus, I've already told. The wand will be costing somewhere close to 3 to 4 lakhs. And the No Pain will be somewhere around 1.5 to 1.7 lakhs. And if you come for Woodpecker, which is an handheld machine again, and if you come for Ostem company also comes up with a computer controlled anesthetic, local anesthetic delivery system, where the principle is the same, but the disadvantage is it is handheld one thing. All the controls are in the hand. You can't hide the needle. But otherwise, I have used that one also. Otherwise, the injection flow rate, everything is the same. That will be costing somewhere close to 60,000 to 70,000.
Okay, so another question from Dr. Suhasini. So is it not possible to achieve the slow administration with regular syringes that we use?
Dr. Suhasini, the problem when you give administer the LA with a regular syringe, you can't regulate the pressure at which you are hitting the piston of the syringe. So it is not the same. You will be thinking that you are giving a very little pressure, but actually the pressure at which the LA comes and hits the mucosa will be too big. Because if you have seen the video demonstration of STA, that is the single tooth anesthesia mode, the drop comes, it takes 4 to 5 seconds for the next drop to come. So that much precision we can't do it when you administer in a slow way. That will be difficult.
So another question from Dr. Ravantika. How much can we pay for extraction if we use this apparatus?
I charge 1,500 for extraction for a deciduous one. A deciduous pre-shedding mobility, I charge around 1,500 to 2,000. Because you are giving something comfortable to the patient. So you can charge that, and it depends upon area to area.
Okay, sir. Another last question, sir, from Dr. Nasim V. So, who is the distributor in India or Kerala?
India, I think there's a distributor in Mumbai who does no pain, and the STA is directly imported. You can check in the website, and you can import from US. There is a US made machine, and if you want to go for a handheld one, Woodpecker is there, Ostem is there. Those are the companies who distribute for the handheld machines.
Okay, so another last question, sir, from Dr. Ankita. So, how much is the pressure in the wand, and what is the rate at which it is injected?
So the rate at which the injection is being injected is around 0.5 ml per minute. So actually it takes somewhere close to, if you want to give a block, it will take somewhere close to 2 to 3 minutes to deliver the block.
Okay.
So that is what the major disadvantage when you are using a computer controlled anesthesia anesthetic delivery system is. It takes time. The time factor is there, but the comfort factor the patient has is too good.
Okay, thank you, sir, and thank you all. So once again, thank you, sir, for being with Online Dentistry. Here we come to the end of the session. So another wait for another punching section from us all. So thank you all. Good night, dears. Take care. Thank you, sir.